Welcome to At the Forefront and our critical conversation today on the disproportionate impact COVID-19 is having on adolescent girls, particularly those of African descent and living in sub-Saharan Africa. My name is Evelyn Sallah. I am the CEO of At the Forefront. We are a global think tank founded in 2017 and now a registered nonprofit in Washington, DC. I'm so pleased to have you here for this critical conversation. It is a time that is really difficult for a lot of people right now. And before we get started with introducing our special guests and panelists, I would like to put out a trigger warning. The information that we'll be sharing today, the evidence, the data, the narratives, and the stories may elicit a trigger for many survivors of gender-based violence, particularly those of you who have experienced intimate partner violence, child abuse, sexual gender-based violence. And so we do encourage you to listen to your body, your mental state. If this conversation becomes difficult for you, please do end the recording or end the meeting. You actually can leave, and we will record this session. You can come back to it when you're in a better state of mind. If during the conversation you need mental health resources, again, we encourage you to actually log off and reach out to us and email us at info@theforefront.net, and we will share mental health resources with you. Welcome to this conversation. We see that we have at least 20 attendees here. We are expecting a full house. We do want this to be a participatory conversation, so please do chat and tell us who you are, where are you joining us from, if you're from an organization, if you're an ally in the movement. At the Forefront is an intersectional Black feminist movement. We believe in coalition building, in community solutions that are driven from and by the community, in Pan-Africanism and gender equality. And that's who we are. If you'd like to learn more about us, we'll be chatting our website and other resources. We are at www.attheforefront.net. Good morning and good evening. I'd love to see you in the chat. Please tell us who you are, where you're calling us from. And I'll just start off by saying that I will be co-moderating this conversation along with my ATF leadership team. Alice Kabwe, my co-founder, she's here, she'll wave, she'll share some highlights to ensure that we are being cognizant of those of us that have disabilities or are affected by disabilities, whether they're visible or particularly if you have some impairment. We'll be sharing some tips. We also are very pleased to have translators here as part of ATF's language justice movement. Bienvenue. Si vous parlez français, nous avons deux traducteurs ici avec nous aujourd'hui. Et voilà, there's a small globe. Il y a un monde. Doreen, est-ce que vous voudriez vous présenter et aussi partager l'option pour nos participants en français?
Bon après-midi tous. Je m'appelle Doreen Donerovi. Je vais faire l'introduction cet après-midi et vous êtes bienvenus. Merci.
Merci. Il y a une petite bande en bas de votre écran, sur le côté en bas à droite. Si vous cliquez sur le petit monde, vous pouvez sélectionner français. Comme ça, vous serez dans une salle spéciale pour les personnes qui ont besoin de traduction. Merci beaucoup. Donc, Doreen, vous pouvez partir à la salle. Merci beaucoup.
Merci.
Et aussi, nous avons une autre traducteur, n'est-ce pas? We have another translator as well that will be supporting Doreen. Please feel free to click on the globe and if you would like to listen to this conversation in French. Thank you very much for that. So before we begin the discussion and really discuss the disparities, systemic, structural, that exists around the world, particularly for Black adolescent girls, we just have a few announcements in terms of the tech and as well as The ability, Alice, can I hand over to you for the ability piece to ensure that those affected by disabilities have access to the conversation?
Sure, that sounds good. My name is Alice, and I will do an example of a visual description that all the panelists will also do as they introduce themselves. So my name is Alice. I am chocolate brown skinned. I have a kind of dreadlock mohawk style going on with my hair right now, wearing a black and white striped shirt and sitting in front of a white wall. So that's an example of a visual description, and that's a way for those who have some type of visual impairment or people who are blind are still able to get a sense of who we are in the room. As all the panelists are speaking, you will hear them say their name a few times before they speak. That's another way to ensure that someone who is not able to see whose pop-up is whose screen is popped up or highlighted yellow is speaking, but they'll know from the name that that person is speaking. We are also using live transcription for our session today. So for somebody who'd like to read along, maybe you're also like on commute, a lot of accessibility, tech and accessibility formats really are helpful for lots of people. So you will see text at the bottom of the screen in subtitle format. And that's another way for you to follow along to what's being said. Just a warning, this is artificial intelligence and some words may not come up as they appear, but we are doing our best with that. Yeah, that's all for me, and I'll hand back over to Evelyn to highlight I think we talked a bit about translation. If you have any challenges with any of the tech translation needs, please feel free to direct message myself, Alice, or at the forefront, who's the host of this meeting. Thank you.
Thank you so much, Alice. We just want to welcome all the new folks that have just joined us. Good morning, good evening. Thank you so much for joining us for this critical conversation on the situation of Black girls across the world in terms of COVID-19 and the unique vulnerabilities that are faced by them. We are having the opportunity for you to listen to this conversation in French. Please, s'il vous plaît, cliquez sur le monde en bas sur votre écran si vous voudriez entendre les discussions en français. Also, we would like to let you know that this webinar will be recorded and shared across ATF platforms. And also at the end of the webinar, we would like for you to complete a brief survey and share your feedback with us. We're always open for improvement. So I would start off by saying that we create safe spaces for Black women at all walks of life, whether they're technical experts, academics, rural women. We truly believe in listening to the voices and elevating the voices of Black women and girls to share highlights of our own experiences. And so I'd like to hand over first to my two co-moderators, the ATF leadership team, so they can introduce themselves. We would like for you to learn more about who they are, where they're based, and particularly what brings them to this space in terms of this discussion. So I'll hand over first to our ATF youth lead, Lucie Amadou.
Okay. Thank you, Evelyn. Hello, everyone. My name is Lucie Amadou. I am a Black woman that's brown-skinned. I am wearing a yellow dress with a paisley red background curtains. As Evelyn mentioned, I am the youth lead for At the Forefront and our Girls of Color project, which is dear to my heart. And I have been with ATF since the very beginning, and what really drives me is the belief that girls can take control of their own life and their future and being able to help them to achieve that. I am originally from Niger, grew up in the US, so I am what you would call a Nigerian American. So I am very proud to be working for girls of color, for Black girls throughout the world, in the US and in sub-Saharan Africa. And I'm really excited to be here to talk about the impact of COVID-19 on Black girls. Thank you, Evelyn.
Thank you, Lucie. And Nana Dagadu also joins us from Washington, D.C. as our health equity lead for ATF. Nana, good morning.
Good morning, good afternoon, everybody. My name is Nana Apenem Dagadu. I'm the health equity lead with At the Forefront, as Evelyn mentioned. I am also chocolate skinned. I am framed by my bookshelf and some paintings in my office and rocking a afro right now, updo, and also wearing a yellow, red, and black African print on top. My passion truly is helping Black girls, but overall adolescent girls, to achieve holistic well-being and to define themselves in ways that are appropriate for them and give them confidence so that they can help everyone achieve what is necessary. So that's it for me. Thanks, Evelyn.
Thank you so much, Nana. And so we are so happy at ATF to have three very special guests with us today. And they are located, all three of them, on the African continent. So good morning, good evening. Thank you so much for taking time out to join us. I'll start with Sankara Caroline, the Executive Director of Akili Dada. Please feel free to introduce yourself in the way that you see fit. We're most interested in your passions. What brings you here? Why are you here today? Tell us about yourself.
Hey, good morning, good afternoon, good evening. I'm Sankara Caroline in Kenya, from Kenya, in Nairobi right now. I'm light-skinned. I'm wearing a mustard cardigan and a blue, navy blue and yellow floral dress. And I'm also wearing spectacles. So I work with Akili Dada, a feminist organization. Our goal, our aim, our vision for all girls in and outside of sub-Saharan Africa is to see young women sitting in leadership positions and positions that are authoritative, positions that allow them to make decisions that not only curate a future for themselves, but for the girls who are behind us, who are coming to sit in those positions in our later years. So yeah, I'm very excited to be in this conversation. I think this is a very critical conversation and really it's very timely. I wouldn't be anywhere else but here this afternoon. Thank you for having us.
Asante, Caroline, and Karibu. I also want to say Karibu to all our attendees in Kenya. I see you in the chat. We're so happy that there is a following here from the Kenya for our two special leadership and organizations, Akili Dada and the Action Foundation. I'd like to take this opportunity to introduce you to Wanjiru Mbugua, who joins us from the Action Foundation, a powerful disability-oriented organization in Kenya that's focused on preventing, mitigating, and responding to gender-based violence. Wanjiru, karibu.
Okay, thank you very much, Evelyn. So I take this opportunity to introduce myself. My name is Wanjiru Mbugua, joining you from Nairobi, Kenya. It's cold. It's cold weather in Nairobi. So going into introducing myself, I'm colored. My color is chocolate, a bit of the lighter shade of chocolate. I wear dreadlocks, shoulder length dreadlocks. At the moment, I'm wearing a blazer, a colorful flowered blazer, and I'm happy to be here representing the Action Foundation. The Action Foundation is an internationally recognized non-governmental organization working, in Nairobi, Kenya, and in other parts of Kenya, working specifically with children, women, and girls with disabilities, with the aim of building communities that are inclusive and also resilient among those persons with disabilities. And I'm happy to be here sharing about my passion, working with women and girls. I really have a big heart for, girls mentorship, for girls, especially adolescent girls. I believe in empowering them to take on the world, because the world is, the world is their stage. So I've been working in girls programs, and especially now with the Action Foundation programming for women and girls with disabilities. And I'm glad to be here. Thank you.
Great, wonderful. Thank you so much, Wanjiru, for being here. I just still want to shout out my Kenyan community here that joins us. Thank you, Joy Kamatu, for joining us, CEO of Better Lives, a community-based organization in Nakuru, Kenya. There's so many of you here, and so it's really nice to see all of you this evening that have joined us. I would now like to hand over to Nsofwa Sampa, who is a Zambian HIV activist and clinical psychological counselor and supporter. And she also works quite heavily in communities of women and girls and people that are affected by disabilities and also infected and living with HIV/AIDS. And Nsofwa, please do introduce yourself to us if possible.
Okay, can you see me?
Yes, I can see you now. Wonderful. Turning on your video.
Okay, thank you. Sorry, I was trying to connect to the video. Yes, so I was saying my name is Nsofwa Petronella Sampa. I'm 29 years old. I'm blind and I have a partial hearing impairment in my right ear. I can't hear in my right ear due to meningitis, which I suffered from in 2009, which also led to my sight loss. I think after I lost my sight to meningitis, which was also due to poor adherence to my HIV treatment, I kind of had, I realized that a number of persons living with HIV and have disabilities are normally left out. So in 2017, after attending the Mandela Washington Fellowship in the USA, I decided to start what I call now the positive movement. So really the idea of the positive movement is to create and to become an inclusive environment for everybody. So we work with women, young people, which is mostly our target. We started out with just young people in 2018, but then realized that we have other people like older women that would be interested. So we brought them on board as well. So we do advocacy work and sensitization to work with people that have disabilities, people that are living with HIV. Also, the fact that we are also Black also contributes to that, because as people that have our complexion or skin color, we are normally sidelined when it comes to such things, when it comes to information, access to services. By the time we get these services, it's a bit too late compared to other people. So my passion is really to work with young girls, because I don't want to see another Black lady or girl go through the same situation I went through, where I had to lose my sight because of poor adherence and things like that. So that's really what I do. So my organization is based here in Zambia, and we are open to partners that would want to work with us even outside the country. I think that's enough for my introduction.
Thank you so much, Nsofwa. Your work is powerful. We can definitely cannot wait to hear more about some of the outcomes that you're seeing on the ground with the communities that you're working with. Thank you so much for joining us today. I also want to call out a few of our participants here. We see joining from all over the world. I see you, George, my countryman from Sierra Leone. Kushe, welcome. Thank you for being here. My name is Evelyn Sallah. I am dark chocolate, mocha brown. I am definitely a Wolof Creole from Gambia and Sierra Leone. My people see me coming, but I have like the strong New York accent, of course, because I'm also a bicultural American. I am typically based in Nairobi, Kenya, but at the moment I'm here in Washington, DC. And I'm just enjoying the sun before I fly back into the winter in Kenya shortly. I am the CEO for At the Forefront, and my passion and driving energy that brings me here, that built this movement that we have today, is the constant systemic and structural factors that have been inhibiting Black women and girls all over the world. It does not matter your geographic location, your economic situation, where you are located. Some way, Black women and girls are consistently, inherently affected by racism, as well as the combined impact of gender inequalities through patriarchy. And I think that today, for this reason, we are here today. We want to talk about what is going on with COVID-19. COVID-19 has not created something new. These gaps have always been there in terms of access, in terms of quality, whether it's health, education, risk to gender-based violence. There are many voices that are not being heard, that are not at the table, and we are here to elevate them. And so we have a big body of evidence. As a think tank, we constantly ensure that we are evidence grounded. We have literature resources. If you would like to have access, we definitely will share them in the chat. I don't want to talk about the data today. I want to talk about the real world experiences, the community experiences, what's happening on the ground. So with everything I've shared here, I actually would like to bounce off to my fellow special guests here, Caroline, especially Wanjiru and Nsofwa. What's happening on the ground in terms of COVID-19? What are we seeing with Black and African adolescent girls, particularly in Kenya, the Zambian context? What's happening on the ground? What are you seeing? What's working? What can we do? And what are the risks? And how can the community support your efforts? So I'll start with you, Sankara. Talk a bit about Akili Dada. What are you seeing? What's happening in Kenya?
Thank you, Evelyn. That's such a packed question. This is a packed conversation. I think what we're seeing in Kenya really happening, I think, so right now schools are back in session, so schools have resumed. But what we saw during COVID period is school terms were interrupted. And as you can imagine, that doesn't mean equality for every single girl that came from a particular household. So then what we saw is education outcomes were interrupted. We saw girls getting pregnant. We saw girls become abused. We've seen a lot of rising cases of mental health issues with girls. This is because when they went home, you know, those spaces are not necessarily safe. So then that said, I think just like you rightly put it, Evelyn, the pandemic really did not highlight things that were not already being experienced by girls and young women. The pandemic only deepened the inequalities. It only deepened the disadvantages, and including also deepened the privileges that people from, other well-doing families were able to experience, such as homeschooling, whether it's private tuition or even virtual schooling. So then what Akili Dada has been doing and what Akili Dada was able to do during that period of the pandemic, even if we're still right, in the space of the pandemic, what we were able to do when the pandemic just happened was ensure that girls were having access to education in their own way. And, this was through radios, for example. So we made sure that we equipped all our scholars with radios. That way they had access to information, because that is one of the things that COVID-19 really did, interrupt. Because in a school setup, as you can imagine, young girls are able to receive information from their, from the stakeholders within the schools. But when they go home, and particularly girls from rural spaces, at that time, COVID-19 was sounding like it was something that was either belonging to the capital, that is Nairobi, or belonging to countries that were abroad. But then rural spaces in Kenya really did not have the information of what COVID was. They did not have information to say the daily briefings that were being given by the Ministry of Health here. So then we needed to make sure that the girls did understand what COVID-19 was and the precautions that they needed to take to make sure that they did not contract it. And even if they did, they knew exactly what to do and where to go get help. So that was one of the ways. The other ways that we were able to do this as well is to cater to the mental health aspects and what that did for the psychosocial stroke psychological status for young girls and women was that we availed group counseling sessions and also individual counseling sessions. And the way we did that was through teletherapy. So we made sure that our scholars and other women who reached out to us had access to a therapist and had access to a space that was still safe. So we did have cases of young women still being forced into early marriage. Others just went missing for a while. And we had to work with, say, the authorities within those spaces to make sure that we were able to track those girls. So now that schools have resumed and the government of Kenya has really worked really hard to make sure that, there's a good sense of normalcy that is coming back to the schools, we have been able to put back all our girls to school. The girls within the communities that we work in, we really are strong believers of peer-to-peer types of mentorship and also feminist mentorship. So we also make sure that even if you're not necessarily a scholar or an alum of Akili Dada, our scholars are able to still impact those who are next to them within the communities that they are in. So those are some of the things that we were able to do. But then outside of that, we continue to do our Akili Dada clubs. We continue to really avail resources that allow for young women and girls to thrive, and not in a space that is defeating, but in a space that allows them to really continue, living up to their purpose and being themselves at their truest forms. And yeah, I'll stop there, then we'll keep speaking. Over.
Thank you, Sankara. It's really powerful to provide opportunities for mental health services to communities, Black communities all over the world. This is the one most neglected area of our health and our overall well-being. And so I commend you for focusing on this piece and having this teletherapy opportunity. Wanjiru, what about Kenyan women and girls that are affected by disabilities? You know, thinking about adolescents, thinking about the work that the Action Foundation does. What are you seeing, and what are you providing as well?
Okay, so thank you very much for that, Evelyn. And to just tie, to what Sankara had alluded to, the issues around mental health. It goes without saying that the issues of mental health, were increasing, and we have noticed that trend increasing over the months that we've had COVID around. And one thing that I can say, in the context that we work in, these are the urban informal settlements in Nairobi, as well as some regions which are in the metropolitan region. These are areas that face economic deprivation. So these girls that we work with, girls with disabilities, women with disabilities, on top of being disadvantaged or facing issues of economic deprivation, you find that the COVID posed a challenge of their risk to their safety and security issues. So girls with disabilities in this case were facing heightened risk of abuse. And when it comes to girls with disabilities in particular, and in most cases girls with intellectual disabilities, they face very high risk of abuse. So in our context, we had cases of even girls in our program who, fell pregnant. Some it were cases of sexual abuse, rape, defilement in this case. So we had a situation where we really were at a loss on how to go about offering this support, because there was that need for psychosocial support. There were the issues of job losses, especially because the parents or the caregivers to these girls are dependent on issues to do with providing casual labor. So at that point where there was COVID, being reported in the first months, and people were trying to limit social interaction. So this means that this household were unable to really get to have income. So we were having that issue of attending to these girls who have also closed school and required to know what exactly is happening. So mental health came up as a really big need, emerging need at the time. And what we did is that through our structured mentorship sessions, whereby we have mentors and mentees. So the mentors are women with disabilities who then mentor young adolescent girls with disabilities. So they were able to reach them. And during that period, the better part of last year, we were having mentorship sessions for these girls. We were discussing issues to do with life skills, offering group counseling. We had psychosocial support for them. We had a counselor who would attend to these girls. So mental health was one of the emerging needs, and especially for the girls with disabilities. Then we have the issue of the prolonged school closures. These girls were talking about being helpless, feeling uncertain about their education. They were not sure if schools would resume. Some expressed, having stress because they didn't know how to face the issue of having to repeat classes. And then you're also looking at the issue about their safety and security. So it was a concern because issues of abuse, sexual abuse in this case, gender-based violence were on the rise. So as the Action Foundation, we are really working together with the mentors and the mentees, the adolescent girls in our program, to just ensure that, post-COVID, we're also having girls returning to school. We've had documentaries around the same, Advocacy, and I believe in the course of our discussion, I'd be able to shed more light about that.
Thank you so much, Wanjiru. I love incorporating the youth, the work that you're doing, the Action Foundation, actually having the youth at the front line as mentors, as peers, as coaches. the importance of having the youth at the forefront of actually making the change. And I think that is something that we're seeing across many programs around the continent, and we found to be quite powerful. So it's very nice to see the Action Foundation on this. And Nsofwa, what about the HIV/AIDS pandemic? We know that Zambia it has one of the highest HIV/AIDS rates in the world. And as a result, there are many eventualities that have come from this in every aspect of life. But I'm very interested in how COVID is in particularly increasing the vulnerability in Zambia.
Thank you for that, Evelyn. I was just listening to, I've forgotten her name, from Kenya, and I was looking at the similarities that we have in Zambia. Unfortunately for Zambia, it's not a pretty sight to see. We have actually a worse case when it comes to HIV in relation to COVID. We had a number of, I'll give an example of the capital city here in Lusaka. A number of hospitals have been linked as COVID centers, which has led to persons living with HIV to not have access to healthcare services. Worse for persons with disabilities. I've had a situation where I had to go to the hospital and was turned back because they said I was okay, I didn't need to come and access services. But I had questions for my doctor, which hasn't been helpful because we're now just made to sit back home and not do anything. And then also because we don't have social gatherings like it has been in the olden times. And then most of our centers where we would have meetings and have time to talk to each other haven't been accessible. Also, Zambia is one of the most poorest countries, I think, in the world at large right now. So our economy hasn't been helpful. We've had challenges when it comes to menstrual health, also with, especially for girls, access to maybe menstrual health services haven't been helpful. And then clinics also are not as accessible as it has been. Worse when it comes to those with disabilities. So it has been a bit of a difficult experience from late 2019 up to date. We've seen some places coming on board, but still, it's not as easy as you'd expect it to be. For persons that are living with HIV and have disabilities, it has even been worse because I think in the country, our culture is still we still have the mentality or behavior that persons with disabilities or there are myths around that persons with disabilities can't have HIV. So we have a number of cases of people that have been taken advantage of, girls that have been taken advantage of in the sense that because they think they have a cure. So I think a lot of advocacy on that has to be worked on. As an organization, we've tried to recruit some members, especially ladies. Unfortunately, we don't have adolescents, but we have young people. And from the WhatsApp discussions and the groups that we've had, the meetings that we've had, we've had a bit of positive feedback. Unfortunately, we still have that HIV is actually a serious situation right now in the country. So I think in terms of COVID, I think maybe just access to healthcare services has been there, but psychologically it hasn't helped us because a number of people have we are just like, we're not doing anything. We're just sitting at home doing nothing, and it hasn't helped our social sector to develop and to also just help to become better people. I've also noticed that, like even with us in Zambia, it's not the same situation like other countries where we are developing. We are still behind when it comes to persons with disabilities, and even when it comes to statistics. Some statistics are not accurate because every year or every day we have new cases of people that are being found with HIV, and some of them are not being documented. We've had an increase of GBV cases like rape and defilement in the country, yet some of them are not being reported because maybe of fear of the person taking care of the child or the girl is the breadwinner or the person that is economically empowered. So I think those are some of the challenges I've seen when it comes to accessing healthcare services and even just the rate of HIV right now. Also, another challenge I've seen when it comes to that is knowledge. People still have myths around HIV. Some people still don't understand especially when it comes to me or people that have disabilities. Some people don't understand the difference between HIV and AIDS, just a simple thing like that. But people still discriminate and stigmatize. Worse still, if you even have a disability and is living with HIV. So I think those are some of the major challenges I've seen when it comes to the way COVID has reacted. Also, I think the aspect of social distancing for those of us with visual impairments, and even just, I think, let me just say, all disabilities has been a bit impossible because we can't social distance. We haven't gotten to a level where our country maybe is very inclusive to a point where I can move and go anywhere without help. So we normally move around with people that are assisting us, and henceforth this has led to maybe the increase in COVID cases. I noticed in the late 2020 and up to date, there's been an increase, especially because of even the weather. But I think the good thing that I've seen is the knowledge has started coming out, because in the beginning, when we first heard the cases of COVID in the country, there were myths around it being only targeted for those that are doing well or the well-to-do and those that are living in urban settlements. But now everybody is like HIV. Anybody is prone to get HIV and anybody is prone to get COVID. So I think it has helped us. Unfortunately for our colleagues which have sign language, it has been more of a challenge because the masking, the social distancing has been difficult for them because they use their facial expressions to be seen. And so when they're trying to say something and you have a mask on, you can't really communicate. So it has led to people just being back home, and it hasn't really benefited as much. So I think those are some of the situations or challenges I've seen. Those are some of the results we got when we tried to have a conversation, like in my group, to see what really is a problem when it comes to us as persons living with HIV and have disabilities.
Thank you for sharing your testimony and so far the work that you're doing that's so powerful. What I'm seeing here is there's definitely the linkage between the economic decline of the COVID-19 pandemic having an additional burden and stress on communities that are impacted by poverty. And as a result, adolescent girls are really at the forefront of getting those impacts. So thinking about the lack of evidence, thinking about increasing gender-based violence risk. And then in addition to that, if you're living with HIV, if you have a disability, you're even more vulnerable. So we've heard some narratives of what's happening in Kenya and Zambia. We like to make the linkage of Black people all over the world. Nana, as a health equity expert, recently the Centers for Disease Control here in the United States shared that racism is officially a health risk. And so why do we talk about race in this factor? This is more about geographic location. When we think about the situation of African-American adolescent girls, what's happening now with the COVID-19 pandemic, and why is race a topic of discussion?
Thanks, Evelyn. I was going to frame my initial conversation or response exactly how you just introduced it, in the sense that geography really does affect things. As a public health worker for over a decade now, I like to think of place, space, and time. And so living in the current context, we want to talk about race, but we also have to talk about where people are living and how they take up space. I will give the example of where I live in Washington, D.C. So Washington, D.C. has 4 quadrants: Northwest, Northeast, Southwest, and Southeast. The Southeast quadrant, which comprises 2 particular wards, have a lot of challenges accessing social services. So that's everything from health, education, as well as housing and food. So there are things like food deserts. People are unable to easily get to nutritious whole foods. That is the context in which people are operating. This is before COVID, right? So when you have African-American people and adolescents particularly who are having challenges facing mental health, physical health, they are living in tight, cramped quarters or no housing at all. They may have been kicked out of their homes for various reasons. I know there are many things here to unpack, but they are facing homelessness and potentially other challenges. And then you add on a virus that is, clearly spread by human contact. When you don't have maybe your own room or even your own home, these are things to consider. The other two things besides the social determinants with COVID, I would say are vaccine accessibility as well as hesitance. So when you add the challenges of the health system already in these poorer areas or with low resources, even in the United States, you then have to worry about, can these adolescents even get to a place to be vaccinated? Are they able to get transportation to go? Can they know, do they have enough information about the disease, about the vaccine, and where to go to get the vaccine? So that has been a real issue. The mayor here in DC, for example, is doing campaigns where they are sending people by foot to neighborhoods to try to get people informed about vaccines. They have offered to call Ubers and Lyfts for people to be able to be transported to get the vaccines, especially earlier on when there were more restrictions on movement and public transportation was a bit limited. So that's one piece of it. Can you even protect these girls against this virus that is quickly spreading, including the variants? And then the last bit maybe I want to quickly touch on is that race specifically, with the vaccine hesitance, there's an added layer for Black girls where they are considered to be strong, right? Strong. And so their pain when they do present with, say, COVID symptoms might be minimized. They may not get tested as quickly. They may not be offered the range of services that people from other races might be offered. So that's that. The last bit I'll talk about is a historic, unethical practice of research on Black populations in the United States. And so things like the Tuskegee experiments with syphilis several decades ago, and other have just created mistrust of the health system, where Black girls, Black people worry that the vaccine, for example, is just another way for white people to take power and to eliminate Black people, or to reduce the population of Black people so that Black people have less power, less access, even less access than they already do. And so there's a lot of suspicion, mistrust, and hesitance to not only get the vaccine, but to engage in dialogue around the disease and other parts of the healthcare system. And so actually when I went to get my vaccine, there were several Black female doctors who were providing counseling on the vaccine itself, the side effects, and providing evidence-based information, which I think helps to counter some of the, whisperings and conversations that people might be having at home and with family around the country as well. So really just some challenging cultural or socioeconomic issues to deal with, and race certainly it's taken long enough for it to be recognized as a underlying cause of stress and poor health, whether mental or physical, among Black adolescents.
Absolutely. Thank you so much, Nana, for sharing what's unique about the US context. So here in the US at least, there's not an issue of access. It's really an issue of quality and an issue of systemic healthcare worker attitudes that reduce the quality of care here in the United States and create mistrust due to the scientific abuse of African-American communities. And what's really powerful is to look at the linkages between how Black girls, adolescent girls have the same vulnerabilities here in the United States around mental health, around all kinds of issues on gender equality and patriarchy, the adultification of girls, We want to take this opportunity to open the floor to questions. We have about 15 more minutes, and we want you as attendees to ask questions to the panelists. And Nsofwa, I know you need to depart. We want to thank you so much for your time sharing the narratives from Zambia, particularly from Zambian women and girls affected by disabilities living with HIV. We are so gracious to, so happy to have had you here. Thank you so much. We see some attendees would like to stay in contact with you. ATF will definitely ensure that we share the contact information for all of our panelists, and that way you can follow their organizations and the great work that they're doing. Please ask your questions. The floor is open. As we move on, we heard what's happening in East Africa, Southern Africa, the African-American context. Let's come to West Africa. We know that we have a history of disparities in West Africa in our health infrastructure, the impacts of the Ebola crisis in Sierra Leone, Liberia, Guinea, and now in the DRC. Lucie, what are you, as a woman who's Nigerian and living in Lomé and Togo in West Africa, how is COVID-19 impacting Black adolescent girls, even though in West Africa, the rates are quite low in comparison to the rest of the world? I think your line is muted, Lucie, so we can't hear you.
Hello.
Yeah, there you
Sorry. Okay, Lucie over here from Lomé. Yes, indeed. As I was listening, we have the same issues in West Africa as came out in the Southern and Eastern African continent, with the difference that although the rates have been very low comparatively to the US or to the other side of the continent, the impact has been probably just as strong economically. Because as a result of the COVID-19 pandemic, the borders have been closed, schools have been shut down, and a lot of things that have really impacted the most vulnerable, which tend to be on this side of the world, the women, and even more disadvantaged are the young girls. So we are seeing this manifest in a spike of early child marriage, as in the case of Sierra Leone, where the rate has increased. Because as you close schools down, even if people are not contracting COVID as much, as you close schools early, girls who were in school may not come back after that and may just be married off. Families, there's a clear correlation on this side of the world between the economy and child marriage, for instance. The poorer a family is, the more likely they are to marry their children young, because that is, with the money of the dowry, you can feed a bit more of the children that you have staying, and also you have less of a worry about your child because they will be into another family that will be feeding them. So we're seeing that, but also a lot of the impact is continuing because now there's lack of mobility. The little informal businesses that people could do are completely restricted. The prices of everything has hiked up, and it is really, I would say, on this side of the world, the impact is much stronger economically than it is psychologically, than it is with the actual COVID-19 disease itself. And it is continuing to help to fuel already, like we've mentioned in the US, some of this mistrust of vaccines as well. You can see a lot of that here, where people are saying, well, they always come vaccinate us and we don't know what's in it, and it's not the same vaccines as the other side of the world. So there's a lot of vaccine hesitancy here, but really the strongest impact on the girls has been them getting out of school, derailed education. Even though that is already a real problem on this side, we're seeing it become worse. Same thing with child marriage. Early marriage is on the rise in a couple of places in the region because of this pandemic. And of course, we can't ignore the big one here being gender-based violence, right? As people are more restricted when the borders were closed, a few of them in West Africa have reopened, but not all of them. people are more confined, and a lot of the responsibilities that were on women are increased. So if we're talking in urban setting, there's a bit more likelihood of that. So very similar to, I would say, to Eastern Africa and Southern Africa, but with a perhaps a more dangerous impact on the economy on this side.
Thank you, Lucie. And the thing is that West Africa has always dealt with these issues, with or without COVID. When you look at countries like Mali, some of the highest child marriage, some of the highest birth rates in the world anyway. And it sounds like COVID is just magnifying this. More contributions from making a comparison with East Africa. Zipporah is saying that in Uganda, girls are dropping out of school due to lockdown and also becoming pregnant. A similar story, Chikondi, where you are sharing more about COVID-19 and the impact of girls getting pregnant in a period when schools are closed. Around 14,000 girls, statistics shared here, have become pregnant during this period. Chikondi, where are you located? Sankara, what's your thoughts on the East African context when it comes to harmful traditional practices?
Thank you, Evelyn. I think it's very clear that the state of Sub-Saharan Africa is pretty much the state of Africa, which is almost very close to the state of the world for young girls and even women. And I think one of the things that has become such a big problem is the continuity, or rather the sustainability of harmful practices. Because if one thing is sustainable, it's the harmful practices that have been happening to a lot of young girls. Because the system is the same. Whether it's declared illegal, whether it's declared, that there's going to be ABCD punitive measures against it, like that, it keeps feeding itself, so it's been very sustainable, it's been very consistent. And I think one of the things that we need to do is to also offer sustainable and consistent means of addressing those problems. And what I'd like to say, what I would like to really hone on, or rather focus on, is the civil society organizations, advocacy organizations, lobby groups, and not necessarily even governments. Because the truth is, it's these types of organizations that are on the ground. So we know what happens on the ground. We know the gatekeepers, we know the guardians, we know the girls that these things are happening to by name, So the one thing that we could possibly do is to ensure that how we curate our organizations, how we curate our interventions is in a manner that is, one, inclusive, and inclusive of everything: the economic status, the social status, political status, even religious status, because all these factors fold into each other. When you think about the greater economic system, whether you're thinking micro or macro, the truth is that if you do not educate a girl, if you don't take a woman to school, if you don't take a girl to school, there's so much interruption that has to the greater good, not only of families, not only of the life of a girl, but of even economies. Then multiply that into continents. So I think the one thing that I would really like to highlight that we really need to do is invest. We really must invest, whether we are investing through human resource, intellectually, financially, even geographically, to be fair. We really must invest in these spaces. And we really have to ensure that we are really programming for girls where they are and through their voices, because many times we were all once girls, isn't it? So we think we know, but the truth is, until you speak to a girl that has been forced into a marriage, until you speak to a girl that has had to drop out of school, whether it's because of school fees, whether it's because they got pregnant, whether it's because within their culture she's not allowed to go to school, you really are not able to curate or design a program that can really cater to her. So there's a lot of humility, whether it's intellectual humility or organizational humility, that we really have to have as leaders within these spaces claiming to want to make a change. So we have to really invest in that. When you highlighted, even that one of the problems that we have is that there's no data, it's true, because we never thought we have to prove that a woman or a girl is oppressed. We did not see this time coming. And now with COVID, we still did not have data. Now post-COVID, everybody wants to do a study and connect the study to post-COVID or during COVID or pre-COVID. But the truth is, even outside of that, girls are still girls. You know, when you go to rural spaces, girls don't even know what data is. They don't even know what a research is. They don't even care for COVID. They just want to go to school. And if they're not going to school, they want to not be physically abused. If that's not happening, they want to be able to access their own decision-making autonomy, their own bodily autonomy. So there's so many things that tends to be put together. And, you know, as we've had from Zambia, you know, as we've had, as Wanjiru has rightly put it, when you think about even other countries, you know, even think about Malawi, yeah, think about South Africa. When we talk about racism, it's not only in the States where that happens, even in Southern Africa, there's a lot of that. So there's so many things that are happening really towards the common good and the greater goal that is just ensuring that young women have access to the right for them to live. So when you think about COVID, pre-COVID, post-COVID, during COVID, the truth is it's very difficult to be a girl or a young woman. It's very difficult. The structural changes, the systemic changes, all of them are just providing something that's of seismic, you know, proportions. So I think, without continuing my rant, I think the one thing that we really need to do is to stay inclusive, make sure that we are girl-centered, and let's ensure that girls' voices are in all the programs that we are designing and curating.
Thank you so much, Sankara. This is, we're clapping all the recommendations we have. You've laid it out brilliantly: girl-centered, youth-centered, community-led. If you must invest, please invest in locally driven movements, organizations, and the actors that are on the ground. We're wrapping up. Thank you for your question. Chikondi just clarified that statistic was from Malawi. Thank you, George, for your contribution on the data point. Very disturbing. Over 90% increase in rape in Sierra Leone. And looking at what's happening with female genital mutilation and cutting, rising rapidly. So all the progress that slowly was being made is now being rolled back. We've talked a lot about girls. So Nana, as a gender and health equity expert, what about the men and boys? What role do they have to play as allies, as partners, in changing the tide?
Yeah, I love Sankara, Carolyn, you said your rant, and those who have joined our conversation before, this is my rant. It is always really important to, you know, think about the fact that girls, we certainly want to center their voices, but they cannot carry the world alone. A girl is with part of a system, right? And so we have to work at all levels of the system. You can look at the individual girl, but that girl operates with perhaps a brother, a boy cousin, right? You are looking at a partner, whether that's a boyfriend of any kind, or a husband, that is, you know, that's someone that she's engaging with. Her parents are a part of the equation as well. And then of course at the systems level. So I think certainly I am all about raising the voices of the girls and bringing them actually to the table, making sure that they are there. But I think we definitely have to work in gender synchronized ways so that boys can have a chance to participate in the dialogue, to really critically reflect on their own needs and roles in this and how they can be part of the solution, part of the conversation, and supportive of the girls and women in their lives. I think it's one thing to say we are involving men, and I think there's always the challenge of balancing power. So bringing men and boys to the table without obviously tipping the scale to feed into existing norms where men take over in a lot of the contexts in which we're talking, but really articulating that we are in this together and that we are, you know, we're all going to either move forward together or we're going to sink together. And so it's not just about, well, that's a woman's problem or that's a girl's problem, but really I'm so happy to see so many men actually participating on in our conversation today. And so kudos to all the guys on the call. It is not a woman only problem, it is for all of us. And really, I think, you know, in programming that we do, it's important to bring even the parents. We're talking about marriage, marrying the girls off, that's parents deciding that, right? And so really, how do we engage the significant adults and others in these girls' life. It might be parents, it might be grandparents, uncles tend to be very important, mothers-in-law, etc. How do we get them to the table and having the same conversations? And then how do we educate the providers, whether they're health providers, teachers, huge. How do we get them to understand and empathize with the girls and really bring a heart to supporting the girls and making things better for them?
Thank you so much, Nana. So many big pieces there. This is a community effort that doesn't just take the women and the girls at the front line, but all of these different actors, parental involvement, the teachers, the health workers, everybody. So as we wrap up, I want to thank you so much for joining this conversation. This has been powerful, just filled with community-led solutions from these amazing. I want to thank our special guests, Sankara, Caroline from Akili Dada, Wanjiru Mbugua from the Action Foundation, Nsofwa, Sampa. We're so moved by your story. Our ATF leadership team, please visit us at www.attheforefront.net. Sign up on our newsletter, info@attheforefront.net. Continue to follow the brilliant work that's being done, being led by Black African women. Final words here. Wanjiru, I'm going to allow you to share. What are your final thoughts? What do you want the people that came here today and spent their time with us, what should they walk away with? What are the actions?
Okay, thank you, Evelyn. So from where I sit, what I would really want to address is as we look at, pre-COVID, during COVID, and even post-COVID, let us all make deliberate efforts to ensure that, we leave no girl behind. And by this, I mean even girls with disabilities. Going back to what Carol mentioned around issues of education, globally, education has been hailed as, the greatest equalizer of all times, but that has not always been the case for girls with disabilities, especially because you realize, for one, for them to access education, it's always there are so many barriers along the way in accessing education, in even getting to be retained and complete education. That's always an issue. There are so many low expectations. There are stereotypes around the abilities for girls with disabilities in education, also how they are perceived in the community, the issues around stigma. So what I would really want to say is that we need to critically question what have we been doing, that has contributed to creating barriers or discriminating against a girl and in their quest for education, in their quest to gain autonomy in life. So what can we do differently? And in this case, can we really also leverage on community-driven organizations? You realize that community-driven organizations actually bridge the gap between policy and practice because they have that direct contact, with the girls. So if we could be having good policies in place, but then the missing link in the implementation is, enabling the community-driven organizations that have direct contact with the girls to really take the lead on this. And even as community-driven organizations take the lead on this, we need to have the girls on board. We cannot have anything for the girls without the girls. We need to have their voices on the table, and not just have their voices on the table, make their voices reflect in the actions, the interventions, the programming that we do for these girls. Because at the end of the day, if we are not cognizant of their needs, of the concerns, of the issues that they bring, up, then we will all be trying to find solutions left, right, not center. But these are not specific to the girls. They don't speak to their needs, and then that means they will not be able to address this. So from my end is just to adjust, to try and be inclusive, actually ensure inclusivity in all that we do, be it education, be it, social services for girls, for adolescent girls in this case, and just ensure that we have the right voices on the table and we engage and capitalize on the community-driven organizations. Thank you.
Thank you, Wanjiru, for those powerful words. As we wrap up, I just want to thank you again for your time. We're clapping for you, Wanjiru. You've said it all. Lucie, there's some comments about harmful traditional practices here, even in Kenya, societies that are just not moving forward and COVID making the situation worse. Lucie, what's your final word reflecting on this contribution from Leah Mburu?
Yes, so I think that for that we need to continue to do advocacy about getting people to understand that not all traditional practices are a good thing. We want to preserve our culture. We want to, to embrace history and the past, but throughout history, regardless of what culture it is, there are some things that are good from it, and there are some things that are bad that we eventually had to graduate from. So I think that is something that we need to continue to focus on, and also challenge that, because a lot of times you do hear, oh, this is our tradition, and a lot of time is a mix of things and perception of people. And when you dig a bit deeper, it may not be how it was originally, traditionally within that community, but certain factors have made it go on that side. But so I think it's continued advocacy on that. But while I'm speaking, if I may, I wanted to add a piece about some of the conversations we had earlier about, girl-centered design, but I also wanted to add to that especially when we're talking particularly about the US, for instance, I'd like to see some policy change. I want the policies and the laws that are in effect to be reflective of the disparity, the gender disparity, the racial disparity that is actually happening as well. And I know we're running out of time, so I'll stop here, but just snapping what was said before about inclusion being the biggest piece here.
Thank you so much, Lucie, for that piece, especially the advocacy. I don't think today we talked enough about what does advocacy look like beyond the policy level, but at the community level, and who should be at the forefront of shifting and moving these communities. We are out of time, and we thank you so much for your time. And final last word, in a word, one word takeaway. This is the challenge, Sankara, Nana.
Ooh. One word is a challenge. I think, okay. I think two things. One, we need to merge culture with consequentialism. When we do that, people will know exactly what to do, because custodians of culture are men, period. The last thing is, girls do not need any more friends. We don't need any more allies. We need coalitions. We need people who can put money where their mouths are. We need people who are acting. We need people who know exactly what we mean. And lastly, education is the common denominator for all human civilization. So let's make sure that all women and girls are going to school. Period. I'm done. Over.
Thank you, Sankara.
Thank you,
Nana, drop the mic.
Okay, one word is talk. We have to continue the critical conversations at all levels. These are complex issues, and we just cannot, today is just one bit. We can't stop here, and we can't stop in our own context. We have to talk with each other, boys and girls, girls and parents, everybody together.
Les garçons, les parents.
Yeah, so
thank you. I believe our translations are coming here. Merci beaucoup à tout le monde. And thank you.
Merci beaucoup à tout le monde.
And I think that my final word is mentorship. Without mentorship, coaching, investing in that way, none of us would be here today. And so please support us through mentoring a girl, mentoring a program, investing in our boys, mentoring them, getting rid of toxic masculinity. It's all about mentorship. Thank you so much. Please join us at our next critical conversation, www.attheforefront.net. Have a blessed day and evening, and we'll see you at the next talk.